Elisa.
Roberta.
Heather.
Brian.
Imagine bringing home a sweet, scented, squishy baby from the hospital. You have so many hopes and so many dreams for this little bundle of joy. As time passes, you're starting to wonder what kind of person they're going to be. Are they going to have friends? Are they going to fit in? Are they going to grow up to be the President of the United States? They're learning to do more and more things. They're learning how to crawl, they're learning how to sit up on their own, they're even walking and feeding themselves, and they might even point to their nose when you say the word. Well, imagine that progression coming to a stop. Imagine going to your 24-month checkup and the doctor telling you, and you having concerns about your baby. They don't make eye contact, and it seems like they knew a few words, but it's almost as if overnight they just forgot them. The doctor brings up the word autism, and it hits you like a ton of bricks. How could my baby have autism? Although autism topics are on the rise, being the latest covers of Parents Magazine, maybe your online parenting forums, or maybe you even know somebody whose kid has autism. A lot of people don't fully understand what it means because it's so widespread and there's more than one kind of autism. So I'm going to go ahead and give you guys the rundown of what types of autism are on the autism spectrum disorder. First, we have autistic disorder, and then we have Asperger's and persuasive developmental disorder. Nobody knows why these kids or people get autism. A lot of people try saying that gluten is the culprit or maybe lack of folic acid during pregnancy, but the truth is that there's not enough scientific studies to show any of these reasons if they're true or not. So, autistic disorder is the more mainstream one. It's what people think of if you hear somebody say, my kid has autism. This is usually what you're thinking of about autistic disorder. Since all the disorders on the spectrum are a delay in the brain's normal development, you have delays in your social interaction and your social interaction and your social interaction. Well, autistic disorder is repetitive behavior. It's usually more prominent within the first 3 years of life. And I'll go ahead right now and show you preschool-aged kids with autistic disorder. You can see the repetitive behavior. You can see the repetitive behavior of doing the lining everything up, and especially this little one while he sleeps, he's trying to line everything up. This is just pretty much textbook autistic disorder, even though every case is kind of different. So then we have Asperger's syndrome. And Asperger's is very similar to autistic disorder, except it's not discovered until later in life, just because the person usually has normal speech, they're not really regressing at all, and it seems like their social skills are fairly normal. Well, then we have persuasive developmental disorder. And this disorder is basically a mixture of the two, maybe minusing and adding some. It's not textbook at all. That's why it's kind of meshed into its own. Nothing fits 100% in with it. So, some signs that your baby may have any one of these disorders, or your toddler or anybody you know, is maybe knowing words and then all of a sudden, really, a lot of people say it's just overnight they lose them. And then walking on your tiptoes is another telltale sign for autistic disorder. And especially in babies, no babbling or cooing before 12 months of age is usually another sign, just because they're not developing normally. The checklist that they tell how to tell if you have a disorder on the autism spectrum is called DSM-4. And in this checklist, it basically tells you it has certain things like no eye contact, repetitive behaviors, just different social and communication delays. And basically, if you have 6 or more checks on there, then you're diagnosed with some kind of autistic disorder. So after you find out that you have autism, or that you are a parent to a child who just found out you have autism, there are a couple things that you should do right away. The first one is to get to a doctor and get your child into therapy. Before getting them into therapy, though, you need to figure out if they're oversensitive or undersensitive, because simple things such as touch, light, smells, just any kind of your senses could have a positive or negative effect on the baby or child or person, and it could have a negative effect. So After you find out what kind of therapy you need, you should do that at home. Just very repetitive, just constantly do it and be on a very strict schedule, because studies prove that people with autism thrive when they're like confined to this schedule. So you should start the therapy at home as soon as possible, just to kind of get everything under control. So now that I've told you everything about autism, I just want to share a couple of points. 1 in 88 kids will have autistic disorder by the time they're 8. And the scary thing about it is that nobody knows why it happens, and there's no cure for it. So it's a very sad and scary disorder, knowing that you can't protect your kids from something. So autistic disorder, or any of the disorders on the autism spectrum, are basically a huge epidemic in the United States, especially right now. As soon as you suspect that your child has autism, you should not overlook it. You should go get a second opinion, and get a first opinion first of all, and then get a second opinion. And if you feel like you need a third opinion, then do that, just so you can get the help that you need and get your baby the best start to life and the best start of being normal that you can. Done? Oh my God.